Like a disease, leftism infects just about everything it touches, and nothing is immune. Once upon a time, the foolish thought that the hard sciences like biology and medicine would be immune from politicization. Nope, social justice medicine is here, and in this video we'll discuss social justice medicine and the frightening speed at which political correctness is taking control of your healthcare. But in order to implement social justice medicine, the entire field of medicine must be rewritten. Harvard Medical School is conducting a comprehensive review of the curriculum and identifying areas that are ripe for enhancement with material on SGM, or sexual and gender minority health, that contain assumptions or errors about sex and gender, such as conflating sexual orientation with gender identity, presuming gender as immutable, or treating heterosexuality as a default. The activists say this initiative isn't about adding more stuff to an already full curriculum. It's about unearthing where wrong ideas are unwittingly getting cemented in people's heads and correcting them from the beginning so they don't have to be unlearned later. Every student earning a medical degree from Harvard Medical School will undergo rigorous training in the science and clinical practice of SGM health. In other words, they're rewriting modern medicine to accommodate LGBT activists who have infiltrated the medical field. Harvard Medical School also removed 31 portraits of its former department heads from a lecture hall because all the individuals are men and 30 of them are white. The hospital's president said she's been considering the move for several years, concerned that the lack of diversity might upset women and minorities who are trained to become doctors. Social justice medicine means even doctors will attack other doctors for their sins of saying true things that conflict with one of the left's identity groups. Dr. Gary Tiggs resigned from his leadership position at Texas Plano Health for his offensive comments after being asked to discuss the gender pay gap in medicine. His comments were published in the Dallas Medical Journal, where he stated that female physicians do not work as hard. Several physicians denounced his comments as sexist and ignorant. He also deleted his Twitter account, and the website for his practice is no longer accessible. While the headline for the story is sure to include the quote that female physicians do not work as hard, there's more to the story. What he said was, quote, "Yes, there is a pay gap. Nothing needs to be done about this unless female physicians actually want to work harder and put in the hours. Female physicians do not work as hard and do not see as many patients as male physicians. This is because they choose to, or they simply don't want to be rushed, or they don't want to work the long hours. Most of the time their priority is something else: family, social, whatever." Okay, now he probably could have worded his statement a little bit better, but when you actually look at what he's saying, he's clearly saying that female doctors don't work as long because they don't put in the hours and do not see as many patients. While he probably shouldn't have said they don't work as hard, in context, it seems pretty obvious that he's suggesting they don't work as long, and that's why they earn less than male physicians. After the backlash, Tiggs said he based his comments on data suggesting that female physicians worked fewer shifts and saw fewer patients, which would result in less pay for female physicians. Tiggs said, "My response sounds terrible and horrible and doesn't reflect what I was really trying to say. I'm not saying female physicians should be paid less, but they earn less because of other factors." In reality, the Dallas Medical Journal knew exactly what he was trying to say, but they decided to publish the controversial statements anyways because, quote, "His opinion is not unique and it's important not to overlook the larger issue that it illuminates." Ah, see, they had to destroy this guy to highlight the larger issue. But while his statement was poorly worded, what he's saying is actually 100% true. Even one of the articles openly admits part of this gap is indeed due to the fact that female physicians do see fewer patients and work fewer hours on average. But do those differences really justify lower pay? Oh, so Gary Tiggs, the doctor who was publicly tarred and feathered for saying that nothing needs to be done about the gender pay gap among physicians, it's only because female physicians see less patients, was 100% correct. Another feminist grievance article covers research that shows almost 40% of women physicians go part-time or leave medicine altogether within 6 years of completing their residencies. It starts out talking about a female doctor who, within 5 years of completing her training, left medicine hoping for more time with her family, but between working as a medical director along with practicing and caring for 2 young children, she felt depleted. She said, "I was burned out, I missed my kids, and I never saw my husband. Then a wild thing happened. I attended a retreat for women's physicians and decided to become a certified life coach." So this female doctor practiced for a few years, missed her family, and then chose a different career path. You'd think having that freedom to do what she really wants to do would be encouraged and seen as empowering to women. Nope. We're talking about social justice medicine. In fact, her choice to choose a different career path out of medicine is evidence of victimhood. Just ask a medical professor who says, quote, "When you invest more than a decade of your life to learn a skill and you're willing to walk away from that early in your career, that's more than a red flag. It's a burning fire." According to the research, within 6 years of completing training, 22.6% of women physicians were not working full-time compared to 3.6% of male physicians. I wonder if this is also a factor in why male physicians make more than women. The emergence of this gap so early in physicians' careers may contribute to later gender inequities in compensation and promotion and suggest the importance of expanding social and institutional support for work-family balance moving forward. They claim people see the statistics and they think women are choosing family over their careers, but often there isn't a choice. But don't worry, you won't find an article about female doctors that doesn't mention discrimination. The article also mentions that 1 in 3 female physicians have experienced discrimination. Of course, all of that is the result of polls on the subjective interpretations of female doctors who are also encouraged to see discrimination by the left. The medical professor continues on, when you have a 40% gap between men and women working full-time, it's clearly not just an individual issue. It's about women making personal decisions within a broader institutional context where both the policies and culture are systematically working against them, she says. Ironically, the article would provide another example. When Dr. Mina Lee decided to stay home with her young children, she didn't expect to return to medicine. Quote, I left because I was burned out, she says. I felt I wasn't doing my best anywhere, not at work and not at home. I cried every day on the way to work and on the way home for months. Lee eventually decided to return to medicine part-time after 18 months. Of course, they don't interpret that as good for her. She can spend more time with her family and still have the freedom to work part-time. Nope. But that's not all. The feminist takeover of healthcare is also complaining that there are not enough women in the C-suite in the medical profession, and their solutions are to address unconscious bias that affect performance reviews and promotions, which are a major factor contributing to gender imbalance. There's no evidence of this other than the fact that there's a disparity between men and women at the top, so the only explanation has to be discrimination. And the solution is often unconscious bias training, or PC mandating training. Speaking of unconscious bias, a leading research firm in the healthcare industry advisory board now regularly pens articles filled with cries about racism in healthcare, like here on how the maternal mortality crisis is rooted in inequality. They highlight a statistic frequently used by left-wingers that black patients are 4 times more likely to die from pregnancy-related complications compared to white patients. In other words, racist doctors are letting black women die because they hate their skin color. Sometimes, when this sounds ridiculous, they'll spin it as just saying that minorities don't have healthcare and they need more healthcare to handle the pregnancy-related complications. But that's not really what they mean. They really mean doctors are racist and killing black women. It's obvious when you look at their solutions for these disparities in pregnancy-related complications are implicit bias training. You know, the complete junk science that can't be reproduced, that's been debunked over and over again. The same implicit bias training given to know-nothing professors by chief diversity officers at your nearby public college must be given to doctors. If that doesn't work, we can always change the rules, lowering the bar into medical schools. I see no problem for this for patients. In fact, it gets worse. There are actual movements to reduce basic medical recommendations in the name of fighting discrimination. This is what social justice medicine is about. For example, Vox came out advocating for decriminalizing mothers who drink during pregnancy. They write, state policies that warn against drinking while pregnant may actually be backfiring and harming babies, according to a new study. Sarah Roberts, associate professor, said she noticed that many pregnant women often avoided getting prenatal care because they were really scared of being reported to Child Protective Services and having their children removed because they drank while pregnant. Not getting enough prenatal care can lead to complications like premature birth. In other words, we shouldn't penalize women drinking during their pregnancy, causing their baby potentially serious and life-threatening harm, because some of them drank anyways. Are you freaking kidding me? Should we also decriminalize rape and murder suspects because the perpetrators will be reluctant to report other crime to the authorities? Second of all, how do we know these complications like premature birth aren't the result of the woman drinking during her pregnancy, as opposed to the result of them not getting prenatal care? But don't worry, they have a solution. A professor of health law at Boston University added that policies to make alcohol more costly and less accessible, namely by raising alcohol taxes and limiting when and where it's sold, have been shown to reduce alcohol consumption. In the name of equality, we should tax alcohol more for everyone because alcoholic mothers can't stop drinking. Got it. And while you may think that just because these movements exist and that doctors don't say anything about them, it doesn't necessarily mean that people within the medical field are okay with it. And perhaps, but the left-wingism within healthcare has completely pervaded the entire field of medicine. Radical LGBTQ organizations in the transgender drug and surgical industry are obtaining name brand support from the nation's largest medical and mental health societies, who provide cover for their experimentation on children who suffer from gender dysphoria. Physicians across the country are using these guidelines set by weak, activist-driven evidence to justify horrendous interventions that cannot be undone. Professor Susan Bewley said, good medical practice would normally be very reflective about an increase in harms. Oh, Susan, not anymore. Last year, the NHS came under fire for administering puberty blockers to as many as 150 children who were incorrectly diagnosed with gender dysphoria when they may have instead been autistic. Gender-affirming doctors authored an article in the Journal of Medical Ethics of the British Medical Journal in which they advise the trans industry how they can prevail over parents who are reluctant to allow their children to participate in treatments such as puberty blockers, cross-sex hormones, and surgeries. In the author's view, there's a lack of guidance for trans providers of gender-affirming medical treatments and how to handle the situation of parents who refuse to give consent to allow their children to be treated with these drugs and surgeries. We conclude that situations where a parent prevents a minor from receiving treatments related to gender dysphoria violate the harm principle and justify state intervention, the doctors assert. The authors defended their stance, citing the Endocrine Society, the World Professional Association for Transgender Health, which suggests that transgender children can make their own medical decisions at the age of 16 years old. However, WPATH, the World Professional Association for Transgender Health, is a political organization. To be a member of WPATH, you only need to have an interest in transgender issues. There is no professional degree required, no training specifically, no certification. If you want to be a member, all you need to do is pay your dues, and that's who they're citing as a source. As I've discussed in my Fake Authority video, activists create organizations with prestigious titles and then collude with activists within certain fields to cite that organization and giving it the appearance of credibility, just like it happened here. Another doctor says, it's really critical to understand that our medical organizations, beginning with the Endocrine Society and moving on to the Pediatric Endocrine Society and American Academy of Pediatricians, have been taken over by the most radical elements. These radical trans activists were involved in writing the Endocrine Society guidelines in 2009 and 2017. These are low to no quality evidence guidelines, and anyone can read for themselves the poor evidence they have for these treatments for children and adolescents. Nevertheless, they cite these societies freely to provide evidence for the benefits of puberty-blocking drugs and even surgical treatments for young people. Sadly, the medical establishment is placing sexual ideology and the profits of treating these children over their own interests. Several experts received a grant for a research study to measure the progress of gender-confused youth. The study was promoted ahead of its completion because the results are already pre-concluded. The authors of the research study are not just dispassionate, objective health professionals. They are hardcore activists, and some are even LGBT identifiers themselves. The heads include Robert Garofalo, Johanna Olsen-Kennedy, and Norman Spock. Garofalo is a past president of the Gay and Lesbian Medical Association. Johanna Olsen-Kennedy is married to a female-to-male transgender, and Spock opened the first gender clinic for children in 2007. Physicians and therapists who embrace transition for children promote a political agenda, not scientific advance. Social and medical transition of children is cold, calculated, institutionalized child abuse at the hands of those charged with healing. That same doctor would also be censored on YouTube for not having a woke enough medical opinion. There are woke doctors all over Twitter, lamenting racism and discrimination to which they are rewarded with praise and notoriety. Physicians that speak out against the child abuse of doctors and the instances of transgenderism are scorned and censored, while practicing physicians actually say things like men and women are the same and that life doesn't begin at conception, two things that are factually untrue. So what does this all mean? I don't know, but it's not good for the medical field, and you, Mr. and Mrs. American taxpayer, will probably pay the price with your health.